Welcome to the Perinatal Wellbeing Podcast. I'm Christine, your host and certified perinatal mental health professional. This podcast is all about authentic conversations. We want to open up the discussions around perinatal health and well-being, from mood and anxiety disorders to breastfeeding to grief and loss in the perinatal period, and everything in between. While this is not therapy or medical advice, it is the place where we are going to continue to open up the discussion around all things perinatal mental, physical, emotional, and sexual health to help reduce stigma and break down these barriers to support. Hi, Morgan. Welcome to the podcast.
Hi, Christine. Thank you so much for having me.
Thank you for coming on. I'm so excited to have you on to share your story of your labor and delivery experience and coming into parenthood and kind of what that was like for you. And the reason why I'm excited is because I think it's so important for us to just talk about our stories and share about our stories. So someone else might say, oh yeah, me too. Or, that was similar for me. Or, oh wow, I didn't know, those kinds of things happened, or whatever the case may be. So I'm really excited and thankful that you wanted to share your story.
Yeah, of course. I think it's super important to just raise awareness for some of these things and shed some light on what it's really like. It's beautiful and wonderful in so many ways, and also can be so hard.
Yes, absolutely. And that's, I think, a big theme on the podcast is really authenticity. Everyone's story is different, of course, and everyone's experience of, how they come into parenthood and what parenthood is like for them is different. But I think it's important for us to be real and authentic so other people don't feel so isolated or alienated if they're also feeling like, today is not my favorite day parenting. And
Yeah,
how
for sure.
Yeah, absolutely. So why don't you share with us your story of welcoming your baby into this world and how that went?
Yeah. So I have currently a 3.5-month-old son. His name's Hudson. So right around like this time last year, I found out I was pregnant. He's the first grandbaby, grand everything, first niece and nephew and everything. So everyone was very excited.
Nice.
Um, and I had the like picture perfect pregnancy. Everything went to plan. All my scans came back healthy. Everything seemed to be growing at the perfect rate. I was happy. I didn't, have too much sickness. I was tired, but that's about it. And yeah, all the testing and everything came back great. So we were, on track for this wonderful experience. And then he came, I was 38 weeks and 2 days. So a little early, but nothing to be alarmed about. My water broke at 3:30 in the morning.
Right.
Called up midwife and she told me to sleep. And I couldn't sleep.
I was gonna say, were you able to sleep? Yeah.
Too excited, so excited.
Yeah.
We tried to rest at least, have some breakfast and stuff. And then we headed to the hospital that morning. And then I was induced right around like 11:30 that morning. That seemed fine. But some of the things I didn't know about induction is I couldn't eat after that. I only had clear fluids, water, ginger ale, apple juice for like that whole day.
Oh my gosh. And can I ask why you were induced, Morgan?
Right. So because my water broke, I wasn't having any productive contractions.
Okay.
So they had to induce to eliminate risk of infection. Because if you water breaks, and the baby doesn't come within about 24 hours. It's a pretty risky thing.
Right.
So, yeah, was induced after being in labor for about 8 hours,
Mm.
technically. But at that point, nothing was happening. Like I could feel some contracting, but it wasn't very painful. It
Right.
wasn't, um, they weren't consistent. Yeah, I wasn't getting the baby anywhere.
Right.
Yeah, so they admitted me and induced me. And basically, that meant I had to be hooked up to an IV. And also, they had to have the fetal monitors on at all times.
Right.
Yeah. Um,
And what was that like
so
for you? Like as a first time, you know, parent welcoming a baby into the world, did you kind of have on your radar the possibilities of these types of things happening in labor and delivery? Of course, as first time parents, a lot of us make a birthing plan, but to really understand what labor and delivery is like, it's hard to kind of think about all these things our first time. Did you have any of these possibilities on your radar?
So I think that I did. First of all, like I had done a whole lot of like coming to terms with being so out of control in birth, like work on myself. Admittedly, a little bit like type A, love to have a plan,
Right. Yeah.
love to be in control, kind of. And so a lot of work pre baby went into recognizing it's okay to be out of control and I don't have control in this situation.
Right. And
And
I have to ask as a therapist, and in when I introduced you, you are a therapist. And so do you think that helped you to realize maybe this is some work that would be helpful?
yeah, I think that, as a therapist, kind of coming to terms with I could use some of these things that I talk about all the time
Yeah.
to my own advantage. And also seeing my clients go through these similar situations gave me the opportunity to possibly be more prepared, but at least I've seen it before. I've
Yeah.
seen postpartum mood and anxiety disorders, as well as like the difficulties of parenting and labor and delivery and all these things. So,
Yeah.
yeah, I think that it gave me a unique perspective, at least, and
Mhm.
to be able to recognize I need to work on this aspect of control because even beyond labor and delivery, so much of parenting is beyond your control. And so, yeah, it was something that was on my radar, probably because of my background.
Right. And I think I talk with clients all the time about how I think parenting from preconception, right? Just thinking about family planning and what do we want our family to look like? And then we start trying, and, it doesn't necessarily go the way we want it to or the way we envisioned it to. And so it's like from preconception, all the way through, I think parenting is just a constant exercise in letting go of control. And for those
Yeah.
of us with anxiety, myself included, that's really hard. It's
Yeah.
really hard to do. So good for you for kind of doing some of that work pre-baby.
Yeah. I mean, I think that it's still a work in progress.
Yes. Yeah.
um, but yeah, I think it's important to like recognize that, like, as a single person,
Mhm.
you have a whole lot more control of your life than once you bring a child into the picture.
Right.
And even like you said, preconception, like you can't control if that sperm meets that egg and when that happens. And like all you can do is try. That's why it's called trying.
Right. Right. Yes.
Right. And so yeah, I think that was one of the major pre-pregnancy psychological emotional work that I did. And so I termed my birth plan birth preferences.
I love that
Uh,
term.
yeah, I think that having a plan makes me feel better.
Yeah.
uh, but in this situation, it was unrealistic.
Mm.
And so it was called birth preferences. And it was very much, I like had spoken to a midwife that was teaching a prenatal class, and she had said the average person comes in with a 7-page birth plan.
Wow.
Yeah, and so
Okay.
I said, "I don't wanna be one of these people."
Right.
Um, who is she equated it to, like, someone coming in and trying to tell you how to do your job,
Right.
uh,
Okay.
when they like, a midwife, I had a midwife team that went that route. They've been to how many births, and this is my first.
Right. Right.
So, it was very, just general preferences, but I had prepared to do some, like, alternative pain management.
Mhm.
My partner, learned counter pressure, and we had been taught different, like, massages and things like that to, as alternatives.
Mhm.
And because of induction, I couldn't use any of them.
Oh, and how did that
uh,
feel for you, Morgan?
I was definitely a letdown. I mean, in the moment, I was fine.
Okay. Okay.
But it was very disappointing for my partner. And I think that's
Right.
something that a lot of people don't recognize is
Mhm.
he had put in all this time and effort and like had this vision as well of how this welcoming of our son is going to happen.
Mhm.
Um, and then it didn't. And so
Right.
that's hard.
Absolutely.
Um,
What did you
yeah.
do for pain management then?
So I only had laughing gas for pain management,
Okay.
which I initially didn't want, but decided to try just because of the change of circumstances.
Mhm.
And yeah, it went fine.
Okay.
But I actually did towards the end, towards like the transition, I guess, of labor. I did ask for the epidural, and it was too late.
Oh
One of
gosh.
those people, but the
Yeah.
anesthesiologist was in surgery and,
Yeah.
couldn't get to me in time before the baby came. So,
Right.
yeah, it was pretty much just laughing gas, and even towards the end, I was so focused that I forgot about the mask altogether.
Right. Right.
So, not intended, but, yeah, mostly unmedicated, which induction is just so intense, and I
Mm.
think that's what I didn't realize is when you talk about an induction, they're like, "Oh, yeah, we're gonna, like, give you synthetic oxytocin, and it's gonna, get your contractions moving along." But what they don't tell you is they're going to be more intense, closer together,
Mhm.
for longer.
Right.
So because your body's not doing this naturally, we're, like, inducing it.
Mm. Right.
uh, yeah, we're making it happen. They were very close together and very intense for 10 hours ish.
Wow. That's a long
Yeah.
time. How do you remember? I mean, there's so many thoughts and feelings going through us in that time, but do you remember how you felt emotionally about that? Do you recall, like, kind of that intensity and it coming on fast and not being able to get the epidural when you asked for it? Because sometimes, I mean, everyone is different, but I know when by the time I asked for the epidural, I was like, "I really need this now." Like, I
Mhm.
felt a bit desperate.
Yeah.
And so what was that like for you?
Yeah, so, the most I felt very calm. Like, I felt like I had mentally, emotionally, and environmentally, which, like,
Mhm.
prepared for this baby and was ready.
Right.
And so these like slight changes of plans, I was like, it's fine. I'm getting to meet my baby today. All these lovely things. I was very calm. But then came the cervical checks.
Mm.
And so the first check I got, I was only 3 centimeters, and it was like a couple hours into this induction.
Mhm.
And I remember it was like hours later, it seemed like forever had passed.
Mhm.
And my midwife had said, okay, in another, one more round of contractions, and then I'll check again.
Mhm.
I said, okay, great. I'm thinking we've made so much progress.
Mhm.
Things are moving along. And I was only 4 centimeters. And I was like, at that point, I had been doing it without anything up until that point, didn't have laughing gas or anything. I was like devastated that
Mm,
it had only progressed 1 centimeter with all that work.
yes.
And so I remember looking at my mom and my partner, and I'm like, I need something here.
Yeah. Yeah, I need some
Like,
help.
yeah, like if that was all that for 1 centimeter, it felt like so just, yeah, the only word I can think of is devastating. So yeah, I knew in my head I was going to be another 6 centimeters, and I'd only moved one.
Yes, yeah.
um, and so yeah, at that point, I asked for pain management options. The laughing gas definitely helped just kind of take the edge off, inhale during the contractions to get through them, and then relax. I was able to relax a bit more in between. But yeah, it was a lot. I think that when I think I was around probably only 2 hours before baby was here, before
Mhm.
Hudson came. Was like so done with just the laughing gas, and so done with like not feeling like I was making any progress that I asked for the epidural. And yeah, it was definitely like, I don't think I can do this anymore. And I think everyone has that moment. I've heard it's very common.
Yes. Yeah.
And my midwife was very kind and said, I will put in the order.
Mhm.
I don't know honestly if he's going to make it here to give you it before the baby comes, because I think you're going to be close. And so I was like, let's not close the door completely. I understand what you're
Right.
saying. I was like, just put in the order, because if
Mhm.
they can come, I want them to come.
Right. Right.
And if they can't, then that's fine. But
Mhm.
um, yeah, it ended up being the super, super intense transition period
Mhm.
shortly thereafter that, and then the pushing, and then he was here. So
Wow.
yeah, it was a lot of emotional lead up
Right.
of, yeah, just like not what I expected, not what I even really knew to
Yeah.
expect.
Right. And I think that's a great point of how your mind can play tricks on you. I know it did for me when I was in labor, just thinking there's no way I can push this baby out. I had a big baby and I found that out before delivery. So that played on my mind like, no, I can't do this. I can't do this. Like, I'm going to give up and just ask them for a C-section, which was not on my radar at all. But it was just so interesting that my mind went there because I just felt like I can't do this. And then
Right.
kind of like past that, and I was like, okay, come on, let's do this, just really interesting. And even what I noticed for myself, and what I've noticed in other people too, is like also how I remember certain facial expressions or things people said to me in those moments. And like my kids are older, like 14, 13, and 10. So and I still remember some of those things. And it's so interesting just how, we're so vulnerable in that moment. We're like extremely vulnerable because we're in intense pain. We can't really run. So we are, stuck, so to speak, in that painful, difficult scenario, and our body is just doing a tremendous thing and amount of work. And it's intense. It is intense.
Yeah, I think that, labor, it's a good, it's an appropriate term for like the amount of exertion physically
Mhm.
that you go through. But I don't know that there's a term for that mental just
Exertion or yeah.
journey you go on of, my labor was 18 hours. So I went from, oh my gosh, my water broke, I think, to, I don't think I can do this. This is the worst pain of my life, to, oh my gosh, I'm a mom. Here's my baby.
Yes, absolutely.
No,
Absolutely. And so what
and
was the delivery like for you? Was it Can I ask how long you were pushing for?
So I pushed just under an hour about, and it was honestly great. I don't
Oh,
know what it is. It feels like you're finally like can do something, I think.
right. Like an
Um
organ.
yeah, yeah, instead of just like going through this pain, it feels like okay, we're here.
Mhm.
So that was great. Um like I said, I kind of set the laughing gas aside by that point. The
Mhm.
contractions felt almost less intense because I could act on them, I think.
Right, right. Yeah.
Um, and yeah, he came within about an hour of pushing. I don't know if that's a lot or not, but didn't seem like it to me.
Right.
Um, yeah, I remember my partner being like, "He's almost here," and the midwife being like, "Not quite."
Right.
Then, I had him placed on my chest right after, and I just remember saying, "He's here."
Mhm.
Like the most just relief that he's finally here.
Right.
But that was quickly interrupted
Okay.
because he's only 5 pounds. So as soon as he came out, and we had no anticipation of that, all his scans were normal, as I had mentioned. The growth was normal.
Mhm.
Everything seemed on track. So the midwives noticed, obviously, he's very small. And so he did cry right away with some massage and everything. And I got to, hold him initially,
Mhm.
do some skin, but he was very quickly pulled away to the warmer to just check him over. So my partner did get the chance to cut the umbilical cord, and then after that, he was pretty much taken just in the same room to the warmer across the room
Okay.
to check him out, and everything seemed fine. But they did want to run some further testing, so I got about 5 minutes with him. One of my midwives advocated with the pediatrician that was there to say, can he just have 5 minutes with mom?
Right.
Because he was breathing, everything seemed okay. Just like they did want to make sure.
Can I ask, was that strictly because of his weight?
Yeah, because he was just so tiny. And so, yeah, I held him for about 5 minutes. I got to look at
Mm.
him, and he got to go with my husband went with him, and my mom was also there for my delivery. She stayed with me after.
Right.
And so, yeah, they were quickly kind of swept away. And then after that, it was kind of this like weird period where I just given birth, but didn't have a baby yet.
Right.
I was also still kind of like out of it a little bit of like
What just
just
happened?
it was disorienting.
Right.
Yeah.
Yeah. And
hmm
how did you react or feel when they said, your midwife had to advocate for 5 minutes with you, for baby with you, but then they took him away, to the warmer. How did that feel for you emotionally?
It was really hard. I think that there's like all this emphasis placed on this like bonding, like this immediate, they talk about the golden hour and like having that immediate connection. And I really wanted to breastfeed. And so that was something that was felt like you got to do it.
Right.
You got to prioritize that first hour and getting the baby latched on right away. And like there's all this emphasis placed on it. And so, yeah, I mean, in the moment wasn't, I was like, he's safe, he's with his dad. They're, like, the doctors are taking care of him. But of course, there's those anxieties that are
Yeah.
like, am I going to be able to breastfeed? Are we now automatically going to have to formula feed
Mm.
or bottle feed? Lots of questions, lots of unknowns. But I was stitched up, checked over. They gave me the tour of my placenta during that time, and
Can I ask
they
you a
think that,
question?
yeah,
This is a for a side note for birthing people. Did you expect or really like know about delivering the placenta?
So like I knew that you had to, but
Right.
it wasn't like a cough. I mean, it was obviously not like delivering another baby, but
Right.
I did have to like push it out in my
Right.
experience.
Yeah.
Yeah.
So did I. And I will be honest, like, yes, I read the baby books, but I didn't really get it that
Yeah.
like how this was going to happen. And I don't know if something was going on with me or like if my doctor was just like rough, but like she was really pushing on my abdomen to get the
Mhm.
placenta out. And that to me was worse than delivering the baby for me personally, because that was really painful. And I was like, I'm done my job here. I just delivered over a 9-pounder. I'm good to go. Leave me
Yeah,
alone.
seriously.
And then, oh, get ready to deliver this placenta. So, anyways, I just wanted to ask that again. This is all about authentic conversations and sharing information and, you know, hopefully helping people to understand how things work sometimes because we don't always get this information, right? And sometimes it's a bit of a shock like, wait, what? I have to deliver something else here.
Right. Yeah.
Yeah.
Yeah. I mean, yeah, I knew about it, didn't quite understand it. I don't think you really
Right.
do until,
Yeah, until you do it. Yeah.
but yeah, the midwife like gave me the tour of like this is where the baby was and this is attached to you, your uterine wall and
Yeah.
all that. And then we had discussed baby small, this could have been why. My placenta was also pretty small and just had some like weird, like where the cord met the placenta wasn't in the middle, some
Hmm.
stuff like that. It's like this could be an explanation of some kind, which was an ongoing theme
Mm.
post delivery was like, why is this baby small?
Right.
Um,
And did you feel like that question of why was coming from you internally or from like healthcare professionals?
all on the healthcare professionals. I didn't care.
Right, right.
I was just hearing baby's crying. He's
Yeah.
here, he's breathing. He, you know, it's like so cliche, but he has all 10 fingers, all 10 toes. He's
Yeah.
here,
Yeah.
breathing.
Yeah.
Um,
He seemed healthy otherwise. Is that right?
yeah, otherwise healthy. And so, yeah, I mean, I could
Mm.
care less.
Right, right. Yeah, it's
uh,
interesting. I'm not a doctor, of course, but um, I've had quite a few friends actually that have had babies around the 5-pound mark. And as long as they were 5 pounds, they were allowed to be in their car seat and taken home afterwards. But never kind of, again, this is just personal experience, but never really kind of heard of people having so much scrutiny and questioning around baby's weight, as long as they're kind of over, like all the other markers are healthy, right? Apgar
right.
test and, all
Mhm.
the other tests that they run, if everything's healthy. Do you now looking back, hindsight's 2020, but any kind of, understanding or reasoning why there was so much kind of scrutiny around his weight?
Not at all. Like it was so Hudson came on the Friday evening and he was small. He had a little bit like slightly low blood sugar, which is common when babies are small. So
Mhm.
they put a little tiny little IV in him and had him hooked up to an IV. But he was perfect. And I think if, looking back now, if we had been allowed more time skin to skin and to do that
Mhm.
immediate breastfeeding, I think that that likely would have helped his blood sugars from what I know now.
Mhm. Yep.
But it happened. His blood sugars quickly leveled out within the first day of his life.
Great.
Um, and he was able to have the IV removed. So, yeah, I mean, they were constantly looking for an explanation. And I think that being a therapist, I'm okay with ambiguity. I'm okay with not
Yeah.
having all the answers.
Right.
I'm used
Right.
to that,
Yeah.
right? That's my job is to create actually probably more questions than answers.
Right.
Um, And so for me, this was fine. I was like,
Mm.
I am okay with accepting he was meant to be this little baby and he's healthy and we're happy. But medical professionals
Mhm.
who are used to, like a 6, 7, 8 pound baby as average,
Mm.
were like, oh my gosh, this
Right.
isn't what's supposed to be. And so what went wrong? And so, like, constantly grilling me if I smoked, if I drank, if there was any sickness while I was pregnant, anything like that. And nothing. It was a very
Wow.
healthy pregnancy. And the other thing that it felt like for me, and I could be totally wrong, I'm not a doctor, but it felt like the OB pediatric hospital world was
Yes.
questioning my midwives and questioning the level of care that they gave me during pregnancy. So I don't know if it was totally them questioning me every time and my own actions, or if they were more so like, did your midwives do their due diligence? But they did.
Yeah.
Everything was normal.
How
And so
how did
yeah.
that impact you, Morgan? Like being questioned that way, right? Like what did you do wrong? And then also what did your midwives do wrong? Like the healthcare providers questioning you in that way. How did that impact you?
I was just confused and annoyed, honestly, that like so many people were asking. So we were in the hospital for a little bit after,
Mhm.
and it seemed like every shift you get a new
Yeah.
doctor coming in asking the same questions. It's like, can you just read the chart?
Yes, please. Yeah.
But they were all so curious. It was almost like the mystery that somebody wanted to be the person to solve it, to ask the right question to figure it out. But there is no explanation. And so,
Mm.
eventually the questions did stop, but especially in the beginning, it was very like, who did something wrong? Who dropped the ball here to make this tiny little baby? And it's like, no, like
Wow.
he's fine.
Yeah, yeah, absolutely. Wow.
And yeah, I think that he's just a small baby, which is fine.
Right. Yeah, absolutely. And so you mentioned earlier about kind of those fears around nursing and that golden hour, like, will I be able to nurse? So, was nursing your baby a preference for you?
Yeah, so it was my personal preference
Mhm.
going into becoming a parent, and
So, how
it was
did that
definitely
go?
it was great. I'm very
Oh,
thankful that we were able to breastfeed. So after I was all stitched up and ready to go, I was
mhm.
able to go upstairs. Our little one was in the special care unit.
Okay.
And so I didn't know this place existed, but it's kind of between just coming with you to the maternity and between the NICU. It's kind of like a middle level of care,
Right.
um, just in peds or
Mhm.
in the NICU. It's kind of mid tier. And so went up there, and immediately he was very hungry after being away from me
Mm.
or he thought he was at least. um, for that little bit. I was like between an hour and a half and 2 hours, and we were immediately able to get a good latch
Wow.
with the help of a midwife. This was like the middle of the night by this point.
Right.
And yeah, so we just kind of went with that. But being in the hospital, again, one of the things I found, because they're very science driven, they were wanting to see how much intake he was getting in order to like make sure that he's getting enough, essentially.
Right.
But I knew from my research and reading during pregnancy that a baby's stomach is tiny
Yeah.
in their first few days, and likely even tinier with a little tiny 5 pound baby.
Right. Right.
And I knew that I already had colostrum before delivery, even. And so they quite a lot, they pushed formula. They wanted to see, like I said, how much he was getting. And so the middle of the first night, there was a nurse, very well intended, I know,
Mhm.
brought us some formula and was like, if he's still hungry, here's some you can give him. We want to make sure that he's getting enough. And so that one time we did give him formula and he spat it up everywhere.
Oh.
Just that first night, we were all just so exhausted. And of course, you want to make sure that he's going to gain weight and like
Mhm.
all those things. And
Mhm.
we knew from that very, it was only the one bottle. And we knew right away, it was like, this isn't what he needs. And so, we kept, of course, open minded.
Mhm.
But it might not be that case in the future. But like
Right.
right now, in that moment, he was okay. And all the right things, all the other indicators, like you mentioned, like he did obviously like lose a little bit of weight, but he was back to birth weight within his first 6 days.
Wow.
Um, yeah, before we even left the hospital, my milk had come in. He had all the appropriate number of diapers, which was all tracked.
Yeah.
He was obviously, like I mentioned, his blood sugars leveled out. Yeah, everything was going well. He was happy. I think a hungry baby would have been pretty upset.
Yes.
Um,
Yeah.
so yeah, he was doing really well with it. So
Right.
it was honestly one of the toughest things we had to advocate for was not giving him formula
Right.
while in the hospital.
Right.
And one of the pediatricians I remember looking at and saying, if you want to see how much he's getting, I will pump for him. But I really think that he's getting enough at the breast. And so we finally found this, not found, but we had this one pediatrician at the
Mhm.
hospital
Mhm.
who just looked at us and said, everything's fine. I think that you're right. And really
Wow.
like validated what we were thinking, myself
Right.
and my partner, in terms of like he seems good with this, and so we want to stick with that.
And I'm curious to know, what for you do you think helped you to stay kind of like really kind of making those decisions, parenting from yourself, saying, like, I believe, I trust myself, I trust my body, I trust my baby, to tell me, kind of what he needs, so to speak, trusting our instincts as parents, especially when you were like brand new, so
Yeah.
fresh, so vulnerable, so tired post delivery. What do you think was helpful for you to stay in that frame of mind, to be able to advocate for him? Because I think it's easy for us to lose that trust in ourselves when something like that comes up. And so I'm curious for you, what was helpful?
I think just the support I had. I have a very supporting partner who, even like when I couldn't be with baby in those first couple hours, advocated, held a screaming tiny tiny baby who was hungry
Yeah.
and said, no, like just get my wife up here because
Yeah.
uh, we want to at least try to breastfeed this baby.
Right.
Um, so getting off on that foot already, we had overcome, that first obstacle of wanting to take the easy route. Essentially, it would have been easier,
Mm,
honestly,
mm,
at that point to just say, yep, give him a bottle. And we didn't.
right.
I don't know if that was the right call, but it worked out for us. And then what kept us going? I'm pretty stubborn,
Fair.
honestly, but
Yeah.
also, yeah, just like listening to him. And I think that's kind of the philosophy that I've taken even since then is like, what does he need right now? And trying to let go of what I should and shouldn't be doing, because I think there's a lot of shoulds of what society like tells you should be doing,
Right.
and it's easy to get wrapped up in the mom groups of
Yeah.
what others are doing, what you think is right versus everything else. But I think that ultimately just listening to your baby
Yeah.
and like I said, that work I did on letting go of control of like I'm new at this. I have no idea. But he is like genetically programmed to at least somewhat have an idea of how this goes. So he will let me know when he's hungry, and he will, at least in those early days, he slept when he was tired, and,
Mm-hmm.
just following wherever he took us.
Right.
um, but that's definitely hard. There's all this information out there of like, your baby should be hungry this often and should be waking this many times in the night and should.
Yeah.
But yeah, it's really about like finding what works for your baby and what works for your family. And
Right.
ultimately, he's the boss.
Yes, yes. I learned that too. My kids are the boss at that time. I
Yeah.
mean, yeah. Um, I love how you frame that and just those shoulds, right? Like for me, when I talk, when I'm, in therapist mode, right? Should is a shame word, right?
Mhm.
It's those shoulds are so, I think, dangerous and impactful to our parenting and our parenting abilities and how it influences us. And, that information overload, right? Like I was born in the 80s, early 80s. My mom didn't have access to this information, right? That we have access to. And of course, I'm a therapist and I love learning and I love research and all those things. And it can be really helpful. And it can be detrimental when it takes us away from our instincts or like from trusting ourselves, right? Because, like you said, we're going to make mistakes where I don't know what I'm doing. I didn't know either, right? It's like, I have no idea what I'm doing here, but I trust myself to figure it out. And I trust myself to problem solve if I make a mistake, right? It's not like I have to do this perfectly and I can't screw up, right? Because when we're in that mindset, I think anxiety is probably very present, and so that being able to trust ourselves, right?
Yeah, I think that it's all about trusting yourself,
Mhm.
in pregnant or even preconception.
Yeah.
It's trusting that if my body's ready to host a baby,
Mhm.
then it'll happen. And if when you get pregnant, then it's okay, my body's doing all that it needs to do for this baby right now.
Mhm. Mhm.
Right. And then, going into labor and delivery, my body knows what to do in this moment.
Mhm. Yeah.
Right. And trusting that. And that's huge. With like, and it is true. And I totally felt it. It's like you, at some point, you just know how to do it. I don't know
Right.
why. I don't know how.
Yeah.
Like nobody taught you
Yeah.
that.
Right. Right.
And then those parenting instincts, at some point, they do come in. And if you let them, it,
Mhm.
it can be instinctual, I
Mhm.
think. And of course, it's so hard to like throw out all the advice coming at you,
Yes.
and just kind of tunnel vision on me and baby and what do we need.
Right.
Yeah, it's hard, but I think if you can get to that point where you're zoned in on this little tiny human, then you quickly get to know what they're needing. And I don't know if even now what my son does is average for his age. I just know that that's how often he eats, and that's how often he tends to sleep, and that's what works for us. So
Absolutely. And I think, we know like there's, some biological factors for sure, but also look at, parents who adopt or parents who welcome their baby via surrogacy and they didn't necessarily birth their baby, right?
mhm.
That, we learn to parent through doing, right? And then those brain changes happen. Thank you, Jody, for the neuroscience. So, I like to refer to her podcast, Mommy Brain Revisited, and she's a neuroscientist and talks about and has done research on the parental brain, but it's that like doing, and making the mistakes of parenting. That's how we learn, right? And so it's also trying to say like, okay, like I don't know this thing. I always use the example like I didn't know how to feed my kid solids. Like
Mhm.
what order you're supposed to go in or whatever, right? But okay, so I found a resource that I trusted and I used that. I did not look for 10 resources. I just looked for one, read that, got some insight, and I was like, oh, okay, this makes sense. And then figure out, with my kid, okay, what is my kid like? Right. And try that and figure that out. And then yeah, there was times where like, okay, that did not work. Back to the drawing board or whatever. But it's like being able to integrate the information too, like because we aren't born knowing how to parent. We do learn how to parent through doing, right? And some of those things kicking in, like of course, our senses are heightened, or we are, have that ability to hear a baby cry from a mile away and things like that. But those like day-to-day things of parenting, the work of parenting, we're not born knowing how to change a diaper or those types of things. So we got to learn, and it's okay to ask for help, ask for questions, but then integrate that with the little being that's in front of you, right? What does
Yeah.
my baby respond to? Like you said, okay, he's feeding at these times and he's sleeping at these times. This seems to work for him and he seems content, and okay, that's what we'll go with.
Yeah, and I think, like, every single baby's different.
Yes.
Right?
Yes.
You can, ask a mom, "Well, what did your baby do at 4 months?" But that could be totally different from what your baby's at.
Absolutely.
And, even these, like, developmental checklists that they send out, it's like, yes, but,
Yeah.
the guidelines, and I think that every single baby is going to land on those milestones, I guess is what they call them,
Yeah.
um, at different times.
Yes.
And, you know, sleep at different times and eat different amounts at different times. But if you can ultimately like look at your baby and say they're happy,
Yeah.
they're not starving, they've got the, appropriate amount of like output in their diaper each day,
Mhm.
things are moving along just fine.
Mhm.
They're gaining weight. I think those are some of the major indicators. Then the rest of it, is usually fine. Like you're probably doing okay.
Yeah. Yeah, absolutely. And yeah, like you said, really just focus on your baby. And having 3 kids, I see how they're all different. They're all unique. All 3 of my pregnancies were different. All 3 of my postpartum experiences were different. You know, all 3 babies, because they're different humans.
Yeah.
Right? So, being able to recognize that and say, yeah, okay, from experience, this worked with the first one. I'm trying it with the second one, but it's not working. I could have easily panicked and said, oh my God, he's not doing this at the exact same time that his brother did it. But that's the way he's doing it, and then the third, right? And so it is like seeing their growth compared to themselves, right? Like you said, okay, he's regained his birth weight. Okay, and since then, how is he progressing? No matter the exact number, but is he progressing? Is he content? Is he sleeping? Is he, well? Overall, I think that's really important because again, I see a lot of times when anxiety is present, those milestones when baby hits them or, doesn't hit them at the right time, like that causes a lot of anxiety. That darn growth chart causes a
Mhm.
lot of anxiety for parents, right? I had someone tell me my baby fell off the growth chart. That's what the doctor told them. And of course, panic ensued, like fall off the growth chart. That sounds terrible,
Yeah.
right? Like and so that's a lot of anxiety for parents, right? And baby ended up being okay. She's just tiny, right? There's
Yeah.
people who are bigger and there's people who are smaller in this world, and that's a whole other discussion. And so how are you doing now, Morgan? You said baby's 3.5 months old. How was that kind of postpartum, post-delivery recovery for you, especially coming out of the hospital with a bit more involved experience in terms of his health? How's that been for you?
It's been really well. So my recovery was very quick.
Good.
um, so I was discharged from the hospital in less than the 24 hours,
Right.
but I was still there with my son.
Yeah.
And then within like, let's say probably 3 weeks, I felt physically back to normal for the most part, aside from, the whole having another human attached to you all the time.
Yes.
Um,
Yep.
but yeah, I say I felt pretty good. And I think that mentally, emotionally, that first 2 weeks is like just a roller coaster.
Mm,
But after that, I did see it level off. And so I'm a huge advocate for like at that 2 week marker, like really take a look in the mirror. Like, how are you really doing?
right.
Um, because that's tends to be where your hormones have kind of come back down to normal levels. And like, you should start to feel not like your old self, but at least okay. And so I booked my therapy appointment for after that 2 week marker,
Good for you.
to say, you know, by this point I need to check in,
Yeah.
um, to so that catch it early if anything's going on,
Mhm.
to have that support there right from the start.
Good for you.
Luckily for me, I did not. So far, of course, it can still happen within the first year, but so far we've been doing well, on that front. And of course, there's difficult days. The cluster feeding days are hard. Even, I have days where I'm like, you should be sleeping.
Yes. Yeah.
Where I think that he had a day where he naps like an hour and a half all day. And I was like, oh
Right.
my gosh, that's terrible. I can't get him to sleep.
Yeah.
But it's letting go of those like shoulds. Like he was happy. I don't know why I was fighting with him. But yeah, letting go of what should be happening has really helped a lot. Overall, we've been doing really, really well.
Good.
Uh, and just each day's a new adventure.
Yes, absolutely. Absolutely. And so it sounds like for you, really kind of having some good supports in place. You said your partner's been very supportive. You said your mom was present at the delivery. You were already seeing a therapist and had booked an appointment for a couple of weeks post delivery. So I love that point, is that having those supports in place, whatever that looks like for you, right? Whether it's family members, extended family, even knowing like, okay, what if I happen to experience trouble with nursing, who can I access in my area in terms of lactation support, whether you can afford someone private, or are there lactation clinics that are covered by OHIP in Ontario, in my area. Just kind of like having those things in place, I think can be really helpful just in case, right? In case we need to access those supports.
Yeah. Yeah,
Mhm.
I think that there's always the in case.
Yes.
um, Having those people that honestly we did need in that first week we were in and out of the hospital with jaundice, which is also super common, but
Yep.
still emotional toll nonetheless.
Yes.
Um, and so having people to like drop me off meals at the hospital because
Yeah.
I wasn't a patient there, so I didn't get fed.
Right.
Uh, and so, yeah, dropping off meals for me, just calling for emotional support. My midwife actually, even though I wasn't due for a checkup, and my baby was technically under the care of the hospital, she came and checked in on me emotionally, like I think 4 or 5 days postpartum,
Lovely.
uh, with everything that was going on.
Yeah.
Yeah, I think that knowing who to reach out to, who you have around you to support you.
Yeah.
That was one of the major factors in our decision to go with midwives was they're like on call for you,
Mhm.
for the first 6 weeks. And so that first week, they were definitely probably on our frequently called list.
Yeah. Yeah.
But even in that first 6 weeks, like anything that came up, we could just call them and ask and have like a medical professional on call, which is
Right.
like unheard of in our
In our system.
uh,
Yeah.
Yeah. So that was honestly, my husband said, I don't know how anybody gets by the first couple weeks without a midwife on call, because
Right.
it's just
Right.
like they're there for, it's their job to give you just the medical research base.
Yes. And I think like honestly, when I had my babies, I didn't honestly realize that I had choice in
Hmm.
terms of like finding a provider. I just, my doctor told me, okay, I don't deliver anymore. So I'm going to refer you to an OB and et cetera, et cetera. And just kind of like, okay. And I mean, the only thing was I advocated for having a female provider that will deliver my baby instead of having an on-call doctor, like just anyone who would deliver me that was on call. And I was very fortunate that I found a doctor who did that and delivered all three of my babies and who I was comfortable with. But out of that realm, I didn't know that I could kind of like quote unquote look around or shop around for, maybe a midwife or, someone else to support because my doctor just kind of directed me and I went with it. But knowing that you can do that, it is very hard in Ontario, absolutely. But even like going with a midwife clinic, those options are there, seeking support from a doula. Options are out there and, just taking some time to look and what feels right for you. And, for some people, like having an OB and having that person on their healthcare team, that's what they want. Great. Whatever works for you, but knowing that you do have options, I think is helpful. Mhm.
Yeah, I was lucky enough that I have a friend who has like a 2-year-old now, so she had recently been through it and kind
Right.
of knew the different options. I was very fortunate in that way.
Good.
And then when I got pregnant, I was able to like do that research and really figure out
Yeah.
what I wanted. And also, I have a doctor who did mention it and did explain kind of both options presented, kind of the two
Right.
pathways for your medical care.
Right.
Yeah, so I don't know if that is standard practice, but I feel
Right.
very fortunate that that was presented to us right away. But yeah, it's definitely like go out and do the research and find what feels best for you.
Yes, absolutely.
But yeah, midwifery care was definitely where we felt most at peace. So,
Right. That's excellent. And so, what do you feel like for you were the biggest surprises about having, a baby, welcoming the baby, birthing the baby? What were the biggest surprises for you?
mm, I was surprised at how your body really just does the thing.
Right, right.
um, yeah, like I said, from you know, it grows this human,
Mm-hmm.
and then if everything goes, all the ducks are in a row,
Mm-hmm.
then you can support this human, or at least I've been able to support this human for 3.5 months,
Mm-hmm.
um, outside of my body,
Right.
uh, with just me. And then, the connection that I've been able to feel with this human is kind of strange. Like,
Mm-hmm.
I've only known him really for 3.5 months, but
Mm-hmm.
don't remember what life was like before him,
Right.
really.
Right.
And like you're always told it's sleep.
Mm.
You're going to be so, so tired. But I think that, at least for me, my body like makes the most of the little sleep that I get.
Right. Yes. I
And
wish
so
I
I
could do that.
I was surprised, and I did some reading on like the um, biology behind it,
Right.
but your body actually like gets into a deeper sleep faster for you
Mm.
to make the most of the shorter periods of sleep that you get.
Right.
as a new parent. And so, yeah, I was surprised I wasn't so tired as I thought I would be.
Yes, yeah. It was amazing to me because I'm a big sleeper, and I'm kinda like, if I don't get my 8 hours, I'm no good. And so I was extremely nervous about that, and not to say it wasn't hard, but I was surprised at how I did handle it and manage it, and I will never forget, like, the first time. I mean, I think this was my 3rd, so it just was the most recent experience, but just remembering, like, I got 4 hours of sleep, and then I took a shower, and I was like, "Oh my gosh, I feel like a new person, like, this is incredible. I got 4 solid hours of sleep, like, I can conquer the world," you know? If I got 4 hours of sleep now, I would not be able to function, like, there's no way. So,
Yeah. Yeah,
interesting.
I didn't know. I didn't
Yeah,
know that, like, your body just, like, adjusts to this new.
right, new normal.
Yeah, and so, I mean, I still do, like, if I'm tired in the afternoon, I'll sleep with him during his afternoon nap,
Sure.
the sleep when the baby sleeps thing, but, like, your body really does, like, get used to this, like, broken
Mhm.
sleep. I didn't know that. No
Yeah,
idea.
yeah, it's
Shocked. I
interesting.
was expecting to be way more tired.
Right, right. Yeah, and, of course, there's so many different factors that go into it, but I think at the end of the day, really, like you said, I love that you said, really checking in with yourself. I think it's easy for us in those first few months to really get hyper focused on baby and baby's well-being and what they're doing, but making sure that we're trying to check in with ourselves to see how we're feeling, how are we doing? Like if we're struggling with that lack of sleep, can I ask someone? Can my partner, maybe have some more time with baby where I can sleep a bit more, whatever that works for you in your situation, right? But being able to just kind of stay on top of your own needs, meeting those basic needs, food, water, sleep, all those wonderful things, connection, talking with other adults where we can. Um, those are all really, really important things.
Yeah, I think that even I think of the baby shower.
Right.
All these gifts are showered upon the baby,
Yes.
and you get nothing. And
Mhm.
so I think that even in pregnancy, it's so important to focus on what you're going to need after.
Yes.
Um, and I mean, during pregnancy as well, but especially that postpartum period of like, what is going to make you the most comfortable,
Yeah.
you know, functioning,
Yes.
uh, meeting those basic needs, and what you really need to get by. It was really like sitting down with my partner. What do we need?
Hmm.
Like realistically, what is our bare minimum to get by? I asked him to, keep my water bottle refilled. Some easy meals, throw in the oven,
Mhm.
microwave if you have to.
Yeah.
Like quick things. Minimum amounts of sleep. Like in the very early days, in the mornings, my husband would get up. I would feed the baby, and then he would take him
Right.
for like until his next feeding,
Right.
and I would sleep that chunk of time,
Yeah.
and that was a lifesaver.
Yeah. Yes.
Because he's not the one that was getting up with him in the middle of the night to feed him, right? So
Right.
he had just had some pretty solid sleep, of course, with a screaming baby in the room,
Yeah.
but
Right.
at times,
Yeah.
but like pretty solid sleep. And so he was able to, take on that little morning shift that really just like I didn't hear the little tiny baby noises in the room, and that
Right.
kind of thing really just made a huge difference. And so finding little things like that, and it's different for everyone.
Mhm.
I've heard of all sorts of different ideas out there, but yeah, finding what really works and how you're gonna get by and enjoy, like
Mhm.
finding time to just spend with your baby and don't worry about all the
Mm.
things is so it's hard, honestly, because
Yes.
there's so many. What you should be doing, of
Yes.
course, and the visitors and all those things.
Mhm.
But yeah, like the taking care of yourself so that you don't look back on that time and like, oh my gosh, I was like not doing well putting those supports in place and what you're really needing so that you can enjoy the little human that you work so hard to bring here.
Right, right. And being able to just feel as well as possible through, that difficult transition and, during your recovery, physically, mentally, emotionally, all of those things, just giving yourself that best chance of being able to, like you said, have some moments where you're enjoying parenthood and becoming a parent and that transition and being able to have moments like I always talk about, for example, taking moments of mindfulness. For me, it was like when I was feeding baby, whether it was, probably not as much attempting to nurse because I had a lot of challenges. So that it was stressful, but even feeding my baby a bottle, but really like I would, stroke their cheek and just really notice their little tiny hands or their little tiny feet or really look at their face and study their face. For me, those were those moments of mindfulness and connection with baby that I think helped sustain me through moments or days that were hard or challenging. But having those basics of care in place can help us be able to access those little moments. For sure.
Yeah. I think that regardless of how you feed baby,
Mhm,
when you're feeding them,
mhm.
it's a great like time for parent and baby. Yeah, to really just foster that connection,
Yeah.
regardless of how the baby was brought into the world, like you mentioned, adoption, surrogacy, all those things. However, this baby has been brought into your life, that
Yeah.
moment of like you feeding that baby, whether it's however it is,
Yeah.
it's yeah, a great opportunity for that. There's not much else you can do in that moment anyway.
Yeah,
Your hands,
exactly. Yeah,
so
absolutely.
you know, you might as well use it. And most of the time, I know for me, my son is the happiest when he's being fed.
Yes.
So
Yeah.
it happens to be also be a great time for them, and those little eyes staring up at you is just,
Yeah.
you know,
It's sweet. Yeah, absolutely. Yeah, it can be a nice, like, calming time and, especially if they get a bit older and a bit more mobile and they're busy and things like that, that can be like that really nice downtime too, where everyone's just chill and we're not running around or moving around or crawling around.
mhm.
Absolutely. Absolutely. And so, Morgan, how, if you wanted to share anything else in terms of, your experience or what you would impart on people coming into this parenting journey, what would you say?
I think the biggest thing is recognizing things are beyond your control. I
Yeah.
think I come back to that. It's
Yeah.
like you can plan and plan and plan, and it can all go out the window. And very, very quickly, you can realize that that plan is not going to work.
Mhm.
And so ultimately, not losing your cool when that happens, what I think is the most important is if you know things aren't going to go how you want them to, how you ideally envision it,
Mhm.
then it's going to be less of a letdown, recognizing that you hopefully will. I hope that everyone has a beautiful, beautiful birth and
Mhm.
delivery experience and postpartum period, but we know it doesn't happen that way for everyone.
Right.
And so, letting go of that expectation and building those supports around you.
Right.
And like you said, whatever that looks like for everyone, for different people, family, friends,
Mhm.
professionals around you that are there for your support and the support of your baby. And yeah, I think that control piece is huge.
Yes, absolutely. Absolutely. Thank you so much, Morgan, for sharing your story and talking about these. I think we touched on so many great points that are really super relevant for new parents and parents in general, just, talking about those supports and dealing with anxiety and like loss of control, feeling out of control, and, what can we control and we can control trying to take care of ourselves and doing our best, whatever that looks like, in terms of parenting. So thank you so much, Morgan. I really appreciate it.
Of course. Thank you for having me, Christine.
Thank you so much for listening to this episode. Please share this podcast with any of your friends or family members who may benefit from it. If you feel you are experiencing any of the symptoms or issues that we discussed today, please reach out to any one of your supports or go to perinatalwellbeing.ca for more information, blog posts, podcast episodes, and ways to connect with us. Check out our new episode every other Monday.